Hey Daniel, how's it going?
Hey, Evan. Feels like it's been a long time since we've been on the podcast together. I know the last time that we recorded, I didn't have a little puppy dog at my feet. I think she's had 3 accidents so far today. So praying another one does not happen during today's session. How about you? How you doing?
I'm doing all right. I'm glad it's a Friday. We always record on Fridays for some reason, but it's nice that it's a Friday. Things are good. Wrapping up the week. Looking forward to next week. A little bit of work travel, but not much. And yeah, if you need to run really quick, run. Nobody wants an accident. So should be a good episode though. And we're coming back from a holiday break too. So this is our first episode of season three. And I guess we figured in due form, our guests today, they started off season two, episode one with us. So we'll just bring them back for the first episode of season three. And thanks listeners for hanging in there during the January short break that we took, this last, month. So.
What are we calling today's episode, Evan?
Well, we're going to talk about startups and leveraging data. We'll see what the actual title shakes out here. We're going to try some new AI that's going to help us start to offer uh, all of our podcasts, and we're going to start to transcribe them so that you can get the transcripts. And it also helps us put together a little bit more unique titles. So we're a little excited to try out some new technology ourselves for the podcast.
Sounds good. We talk about tech all the time. I'll introduce our first guest today. So if you already know what season two, episode one was, we have our friends back from Claim Capital. And so our first guest is a former Epic employee with the claims and remittance team, really focused on data analysis and automation, and is the chief executive officer and founder of Claim Capital. So welcome back, Austin. Thanks for being here.
Great to be back. Thank you for having us on.
Well, and I guess our second guest doesn't need a whole lot of introduction either, but also former Epic, Claim and Remittance, the director of client operations at Claim Capital. Welcome back, Spencer.
Yeah, thanks for having me. Happy to be here for the new season anniversary.
All right. Well, we're excited to have you both back. And for today's episode, we're going to take a little bit different spin than we did in season two, and where we learned about what you're doing. And we want to start out today's segment talking about what it's like creating a startup, and specifically in the healthcare space. Like, what has that experience been like for you all? Austin, I don't know if you want to start us out.
Sure. Yeah, it's a very interesting industry, not just healthcare, but also tying that into technology. Healthcare itself is obviously a massive industry. You've got trillions of dollars of transactions going forth every year. And then the actual data behind it and the IT infrastructure, there's just a lot of complexity. So it's interesting because you're not selling a product to an individual buyer. Your market are it's going to be these giant multi-billion-dollar organizations. So it adds kind of a lot of red tape, long sales processes, but it's been very interesting.
And I know, like, just even thinking about, I live next to two health systems, and they're merging right now, and it's like, or I think a press release came out like a week ago that they're merging. It's like, what does that space look like when you're competing for clients when the your client list is going to be changing all the time? That's got to be a bit of a challenge. What was it like for you all, like thinking about, okay, I have this idea, I want to sit down and make this, thinking about the regulation in the space, the need to protect data, like what were some of like the first steps where you're like putting this together and you're like, maybe this could be something?
Yeah, a lot of that was more or less learn as you go, right? It started as the idea whenever I was at Epic, just seeing all of these gaps in the analytic capability around just such massive issues like denials, where, I mean, organizations will get billions of dollars in denials per year. And then having that just be kind of grouped together in slicer dicer or a pivot table, it just was still leading to all of these holes. And so that was kind of my process. Is I had a background in statistics. I was studying to be an actuary. I had gotten into programming in college. And so as I was seeing these gaps, I figured we'd take a stab at trying to do things a little bit better. And then, we obviously go through a lot of the kind of healthcare training. You get a lot of exposure to that at Epic. And obviously with that industry, you have all these regulations, right? The, crucial importance of protecting PHI and being sensitive with data, everything like that. And so it was definitely a learning experience, but we had, kind of a long window where we were starting the company, starting to build out the product, doing the development, where we were able to keep all the other avenues of working in healthcare going by getting all the cybersecurity insurance and the contracting and the AWS infrastructure and bringing in all of these, cybersecurity professionals to make sure that we are living up to the standards that are needed for this kind of data.
So taking a little bit different spin. So now you're up and running. So what does that look like for a new startup within like that 24-month period? What are some of those targets and goals that you guys were like, hey, we have to achieve these elements to be able to feel like we're successfully moving us forward as a group?
Yeah, I think the biggest differentiator there is whether the startup goes kind of the venture capital route or whether they're going, kind of organic and homegrown. Where if you're getting, VC funding and you're trying to go fast and loud and you're raising millions of dollars to hire a team of a dozen engineers and salespeople, a dedicated marketing team, at that point, your timeline shifts because you have so much on the outsets of your startup that you can scale things a lot faster. And so we've kept things organic and, kind of homegrown in the sense that we didn't want to go that route and give up all of that equity. And we were fine kind of taking our time with making sure that the product was being done right and then building it out, on our own timeline. So for us, I mean, the first thing for any group is to get a minimum viable product if you're going to be delivering software or a software-backed product. And so that I think changes depending on your development capacity, but 6 months to a year, I think, is when you really want to start actually making sure that your product is doing what you want it to. And then from there, it's really about getting clients. And it's, you're not going to walk up to one of the largest healthcare systems in the country, and that's going to be your first client most of the time. They're going to want you to have proof of concept. They're going to want to see demos and your product. And so what we did is we took, small steps, getting larger and larger clients. And Spencer can expand on that piece too. But I think in that 2-year window is when you really want to start seeing that proof of concept.
Yeah, the measurement for success changed dramatically over the years here. First couple of months or that first 12 months of us working, it was a lot of me picking up the phone and calling groups that I thought might be interested. It was a lot of cold calling and just trying to get in touch with somebody. And what I would consider a success was just getting a response in the first place. It was just like, oh, this person responded, and then we get our first client, and now we've established more of that MVP, or we were able to actually get our hands on some data, start working on some stuff, and then that measure of success changes. Now we're having successful actual client engagements. We're actually delivering good results that are producing positive change in these organizations and having successful sales pitches. So yeah, it was a lot of nitty-gritty work to start with, a lot of picking up the phone and a lot of manual stuff, and that's changed over time.
Yeah, and in order to even get that started, we just started offering our services for free. We had the MVP. We were ready to start doing some of the analysis, and just in order to get any amount of real data in there, we were just calling groups and saying, look, if you give us the opportunity, we'll do all of this for free. We really just want an opportunity to prove ourselves, to build up a network, to improve our product. And in order to do that, you need real life data. So that was kind of our approach of just starting to build up a client base just by offering for free services. And then after they saw what we could do and we made the product better, then we were able to roll that into actual paid contracts with some of those organizations and then start going to larger and larger groups.
Yeah, it's always very like nostalgic in a sense to look back on like our first pitch decks that we made, or our first like outputs we created with like our with those small clients, those local organizations we were able to work with, and then comparing that to now when it's like, yeah, we've come a bit of a long way so far and still lots to go.
Now that you guys are in with several clients, how is that work? Like, how are you guys able to start to leverage those relationships to be able to expand? I mean, I'm sure neither one of you in college were like, "Hey, I'm going to go be a venture capitalist and start up my own company and move forward." I mean, we all had different trajectories that got us here. But like, how are you guys trying to leverage those current relationships to really grow and expand so that, I know with your guys' solution, we'll get in a little bit later in another segment about what you guys are doing, but you definitely are probably gauging and being able to leverage other people's information to help other potential health systems as well.
Yeah, that's a huge component of it. And I think making sure that you have a strong relationship with each client where you're not just behind a curtain and providing a product, you are working with them, both in the sense to help them and have them help you, and that you're going to learn so much from each group. Each group is going to have kind of their own nuance and issues and requests. And so, really partnering with them to hear more about that and then improve our product to address that. It also helps us the next time we get a different client and they have their own issues or they have their own requests, because some items can be standardized that you can approach the same way for any given organization. But then you have all of the things that impact that, like what is their EHR? How is that EHR configured? What functionality are they using? What is their payer mix? And how are those payers doing things differently than the other ones? So there's a lot of nuance there, but by having that relationship with the client, you can really get good feedback on, what would bring them value and what can you do in your product to improve that.
Yeah, I think we probably hit on that even a little bit at the beginning of last season's episode. But yeah, a big component of us has always been that collaborative nature where time allows, like we want to be meeting with your SMEs. We want to be looking at the data through the lens of your organization. And we don't just want to hand you output and then say, all right, good luck, you can untangle this. We want to decipher that ourselves with, with our own analytics and our perspectives and our consultants who are looking at these things. We want to be able to provide pointed recommendations that are actually going to, you don't have to do all the work yourself. We're going to guide you along that path.
I know you mentioned earlier that, starting out, you're making maybe some cold calls to try to get clients, and thinking about it now in the future, the AI market's a little, I don't want to say on edge, but it's, there's been an implosion of sorts, at least for certain names out there. And I'm curious what y'all's reaction is to that, or how marketing has been just when clients hear about AI, or potential clients hear AI as a solution, how that interaction goes for you.
Yeah, definitely. It's a really good question from kind of an industry perspective, because people see, we get the Becker's articles, we're seeing all the stuff going on, and we're seeing these very large giants of organizations going under, or, making layoffs, huge changes like this. And you might raise an eyebrow and say, well, is this stuff slowing down, or what's going on? I think if anything, it shows the inverse. There's enough demand that this company couldn't fulfill all of the needs they needed to, and they, unfortunately had to make some adjustments, which to us says we're still on the right track, because we are providing these things what we consider to be the right way. The market is still there. We still need technological solutions to the issue of, denials management specifically. It's just more so the tact that you go across, you go about that, because it's understandable that people are wary about this. Not only is it a new technology, it's something that's developing very rapidly, which alone is going to make someone hesitant. But then you do see, these shifts in the industry as well. So I think it just comes down to the, and also you can speak a little bit to this as well, kind of with how we handle our sales calls in the first place. But we like to be as forthcoming as possible to show that, we're not keeping a lot of technology behind the curtain. We're not trying to hide things from you. We want you to know how your data is being used, so that you feel comfortable with the technology that we are applying to it,
Yeah, I think a large part of it is also kind of biting off more than you can chew, or trying to branch out too quickly into too many different avenues. I think the the implosion that we're talking about with the company that shall not be named. But I think there's there's so many different issues that that organizations try to go after at one time. And especially if you're, venture backed with hundreds of millions of dollars at that point, there's this expectation and this time pressure that you need to live up to it. And then seeing how organizations try to address all of those issues, it's difficult to build out that much functionality, no matter how large your development team is, if you're trying to go 100 different directions. Right. If you're trying to be a clearinghouse and do prior auths and do denials management and utilization management, all these issues that get people excited because they're prevalent in healthcare. But whenever you try to address all those at one time, and especially through things like acquiring other companies who might be specialized in some of those areas, you're trying to add pieces to a puzzle from entirely different puzzles. And those often don't fit well together, or if they do, it doesn't look very pretty. And I think that's kind of one of the risks of trying to do too much too soon and not building it out organically, where you know it's going to work with the rest of your code base and your product and where your strengths are.
How do you guys manage that, like that slow growth to organic growth, but also trying to stay ahead of, the EMR systems that might be looking at the similar types of solutions of what you're building out to make sure that you're ahead of the market in that regards, versus, being reactive and then coming in with a similar type of product or solution? Like, how did you guys think that through as you were getting ready to launch of, we got to get a client, we got to do this slowly, but at the same time, how do we stay ahead of everybody else?
I think that comes down to, I think something that's worked really well with our group is just our communication with our development team to set the expectations and kind of the limitations of what do we feel comfortable taking on right now. Because if we stay specialized and we do the best that we can on what we know that we can do, then that's going to help us stay ahead. An organization that throws 100 developers at something, they might be able to get a lot of stuff done quickly, but you're still pressing up against knowing whether or not it's going to work. You're going to have a lot of different hands, a lot of different cooks in the kitchen, and you're not going to know if it's actually going to come together. And so that's something that most of our development team is either ex-Epic or has revenue cycle background. And so being able to sit down and the actual development team knows the requirements of what we're doing and they know how it all works, that has been invaluable to still being able to go quickly, even whenever we're a lean team.
I feel like with the venture capital as well, and when you throw all these developers at something, you almost get a little bit of an Elizabeth Holmes situation where you promise something before it actually works, or it's actually like available, and you maybe sell something to a client that never actually is possible. But what is something that, as you're having conversations and you think about like specialization of a product, that without sharing like too many secrets about like conversations that are going on, I'm curious, like where do you see clients like trying to push you all towards, or things that you all are interested in maybe branching out on? And I know we'll talk a little bit more about it later about what Claim Capital is doing at the moment, but just like what's coming up in conversations, what are some hot topics out there?
Yeah, I think one of the biggest things is denials continue to increase. And I think it's around the concept of what can be prevented versus what are we just going to accept the fact that this is going to be a first pass denial, right? Some of these are going to go out and get denied. And so at that point, it's a matter of now what? How are we working these? How manual is that process? How are we reducing the noise between what can and what should be worked and what we should maybe write off because you're not actually going to be able to recover that, or at least not efficiently. And so one of the biggest projects that we've done recently is in the space of kind of appeals efficacy. So instead of just analyzing, kind of isolated claims to see the differences between them that's leading to denials, we string together series of claims. So we factor in where are we rebilling claims and where are we seeing appeals, and kind of factoring in the entire history of a set of charges in order to help guide and influence what should happen if this does get denied, right? If we only have a 10% success rate appealing a specific denial to Aetna, and that's causing other denials that have a 90% success rate to Blue Cross to go past timely filing, that's a gap in priority because we should be focusing on the work that's going to bring in the most money. And so that's been one of our largest efforts. And I think where we're seeing a lot of interest in our clients is in that space of saying, what's happening after I get this denial that we can't really prevent.
All right. Well, on that note, let's take a quick break and we'll be right back.
There are thousands of medical offices and facilities across America, each navigating through changing regulations and reimbursement models while striving for positive patient experiences and outcomes. A common element in each of these facilities is patient access, the front line of both the revenue cycle and the patient experience. Though diverse in facility size and geography, patient access professionals unite around a common purpose: enhancing the overall patient experience to increase patient satisfaction and outcomes. Through it all, one organization is there to educate, connect, inform, and pave the way toward the future of patient access. The National Association of Healthcare Access Management recognizes the changing role of patient access professionals and their increased importance.
And we're back.
All right. So we're going to jump into our debate section. I think we have some fun topics, just talking about what our friends here are doing with data and analytics and driving results to clients. Evan, you want to start us out?
Oh, I guess. Sure. So, let's talk about like, what have you guys been doing? Like, we know what your product does. It's really around, assisting in the denial prevention. And for the listeners, I definitely highly recommend you guys going back and listening to season 2, episode 1, and then come back and listen to this one. But tell us about, like, where are you guys finding some of the quick wins with your clients so far that were able to prove your guys' success to be able to move forward with, establishing new relationships with, I think, as Spencer tells us, new logos on your platform. So
Yeah, apart from that appeal efficacy we chatted through before the break, one of the biggest areas that we typically see those quick win issues are mainly where it's payer nuance, where it's kind of misleading in terms of how they're responding to different items, right? Because if a payer is using a specific reason code and remark code, and that is actually describing what they're looking for or how to fix it, then organizations typically have a handle on that. They know what to do, and they'll go in and do it. They either have the follow-up teams to go in and do those appeals, or if it's high enough volume, they're looking at it and they're making the build fix on their own. And so really where the largest issues that we see are within areas where it's misleading in terms of the actual cause. And that has been the biggest benefit of the machine learning, where we can say, all right, even though we're getting this denial code that will typically point to a coding issue, it actually has nothing to do with that, because these are the most significant features of the claim coming back as leading to this being denied. And so sometimes that takes conversations with the organization to say, this is what the models are showing. Does this align with your understanding, or what's your context on, why this would be significant? But as we've seen more and more cases where that machine learning is accurate, even if we see something that we wouldn't typically piece together as the cause of a denial, it gives us confidence that if the models are saying this is the issue, we've seen enough cases of this where we could be confident that this is likely the cause.
Oh, go ahead, Evan.
No, you first.
I was just thinking, like, if I'm a client and I'm working with you all and you have this model, I almost want to be spoon-fed results versus taking my own pass at it. I'm curious, are the folks that you're working with, like, really interested in just having a model tell them what's happening, or do they want to take it a step further and work with the data on their own?
We take the initiative to provide the recommendation. We know how busy organizations are, and a lot of things kind of fall into the back burner because there's just so much to do, and keeping up with the latest Epic functionality and making sure that you're keeping up with payer requirements. Organizations don't have time to dig into the data themselves. So that's where we take the approach of going as far as we can by getting the context of what they're doing today, getting the context of the issue, and then providing a discrete recommendation wherever possible to say, this is what needs done, right? You could submit this as an SLG to your Epic TS, and then that is going to be, addressing this given issue. So as far as we can take those issues, we do, because organizations typically don't want another dashboard to look at. They don't want another model that they have to have analysts go through and determine what to do themselves.
Do you guys, how do you, like beyond an SLG to the Epic analyst, how are you guys partnering with other companies to say, like, let's say there isn't an IT component or a resource to be able to do that build? Are you taking your prior knowledge and expertise and jumping in and offering that service, or are you referring that type of stuff out, like to expand your partnerships with others? I just kind of thinking through, like, you're probably finding a lot, but knowing that IT resources are so limited with the number of upgrades and break fix issues and putting patient care first versus denial management first, those resources tend to not be there to be able to maybe take some of those recommendations that could be quick wins, right?
Right, that's completely fair. And that's where we have, relationships with the Wilshire Group, where maybe it takes a consultant for 6 months to help drive that project forward. That is something that we don't get into organization systems and fix it on our own, because we don't have the background on all of their build, all of their context. We would want the input from someone at that organization, or to have an outside party come in who they're dedicated to that organization or that fix at any given time. And again, we're there to support with as much data and recommendations as we can, right? One of the things that helps a lot is being able to provide the discrete cases and examples where these things are happening, provide cases where their appeals are working. And so they're able to use that to facilitate the process and make that a little bit faster. But we also keep an eye out for opportunities like RPA is another huge, huge opportunity in this space. And we don't do RPA ourselves, but we know a lot about it. And we know where it can be leveraged. And that's robotic process automation, or bots you have likely heard about. And that's where you have a very consistent manual task that needs done. And you can have an RPA vendor make a bot to automate that process. So whether that's dragging and dropping documentation from Epic into Availity or a payer portal to resolve a 252 denial, there's a lot of opportunity there. That also helps with, okay, well, we don't have enough resources for this right now. That's fine if you could have a bot and you don't have to worry about your own staff having to go in and do those things.
Absolutely. It makes me think of like a client that I've been working with for a while now. They are trying to take 5 campuses that all run, well, 5 health systems that all run their own revenue cycles, but trying to leverage coming together to say, like, hey, this is what's denied, this is what they're receiving as denial. But we are seeing success at one campus of like getting a lot of these overturned and moved forward, but the other 4 aren't receiving this. And I think it's based off what you guys have continuously shared with us, taking all of everybody's data and saying, wait, this organization's winning these through this. Why aren't you? And you guys are on the same contract component. Being able to leverage and see that might be something that they could actually see through your system versus having to talk it out and say, are you having this problem? I'm having this problem. And then trying to reconcile that type of data to then go into the 835, 837 and say, what are those remittance? What did we send? What's the differences and changes? It sounds like people could definitely leverage even to say, how do we come together and have you guys run that data to say, oh, this was a win, this wasn't, that type of deal. So.
Exactly. And especially even highlighting those potential gaps in contracting, where if our models say, there's no difference between these claims or the way that you're billing these services out, but they're still getting paid from this one group and this other group, then we could bring that to the organization and say, functionally, there's no difference in how you're billing these two, apart from what service facility or billing provider, anything like that. Do you all have different contracts related to these services between these two groups? And that can often highlight those gaps where it's not how they're billing it. They don't need a change in their Epic functionality to address that issue. It's a matter of contracting and how they need to work with the payer to say, hey, You're paying us whenever it's out of this group. You're not paying us out of that group. Let's get that aligned because I know that these services and the way that I'm billing it is actually correct.
I'm thinking selfishly here, just as I'm working as a revenue integrity director, and on the side I have somebody messaging me about an edit, and I'm thinking to myself like, man, there's so many edits that I work that I don't even know if they prevent a denial, or like, is my team doing unnecessary work when we would get paid anyways? I don't know if a data model can find like work being done versus the denial prevention, or if it would, like, if there's any value add. But I'm just thinking, just like with all the data that's out there, it'd be really, really cool if you could analyze actual end user work and its impact on denials, denial prevention, or if it's not doing anything at all. Not that that data, I don't know if that data is available or not. I'm thinking out loud just as we're talking through this and thinking about how do we prevent denials. And you were saying like, what's a first pass versus something that's preventable. I guess maybe to give you an actual question though, when you jumped into this space of working with denial prevention, has the outlook for denials improved in your mind, or as you've gotten into the data and the details and working with clients, you're like, man, this is much more of a mess than I thought it was going to be? Like, what is your change from like day one to now as far as like the outlook and opportunity?
That's a really good question. I think the issue is that payers are always going to find a reason not to pay. If you fix one issue, another one's going to come up. It's like whack-a-mole. There's always going to be something, right? Because if organizations started paying 100% of every claim, then that's billions, if not $1 trillion. And so I think my initial understanding whenever I started was that there was obvious complexity, especially whenever you look at all of the different niche payer requirements. I mean, these online manuals can go hundreds of pages and outline all these different cases. So I think for situations like that, yeah, I was blown away as we've gone through some of these things, the levels of complexity and requirements. But that's also reinforced the issue and the need at organizations because they're likely not able to get through all 1,000 pages of all those requirements themselves. And if we can use the data in order to kind of figure out what those are, at least the most important and the largest, most impactful ones, that is really what we've been able to see. And even with that complexity, it's at least a little bit better managed with better tools.
Yeah, I think that's one of the more exciting aspects of the work we do. We have tons of statistics and other models going into things, and then these are all very complex issues, but there's just kind of a fun enjoyment from getting a really discrete output from your machine learning models to say like, this is kind of a strange element, like Austin was referencing earlier. Here's an element that might not necessarily make sense based on the denials that the payer is actually giving us, but this is truly the significant component of this. And just seeing that output come from we call our system Karma for claims and remittance monitoring and analytics, but when that output comes out of her, then like just seeing it discreetly, it's this element right here, which someone probably wouldn't have gotten to, just looking at it in a pivot table. That's a very cool feeling for us.
Have you guys started to see your clients take like the data now and start taking those to like denial prevention governance groups, or what are they doing beyond taking your recommendations, right? And how are they building kind of PDCA programs or prevention programs around around the outputs? Because there's going to be a component of like, you make the recommendation, but there's also still usually an operational change that needs to take place, whether it's from the clinicians or whether it's from the revenue cycle itself. But how are you starting to see your clients leverage everything and actually start to engage others outside of revenue cycle?
Yeah, I think we see a lot of that. What's that?
That it was a curveball. Sorry.
Oh, good. I think we see that mostly with the kind of overarching denial issues that almost every organization has, right? So if we're looking at registration denials, authorizations, attachments, where you have all of these different parties in play, right? You have your front end registrars, you have your HIM team with the documentation, and now you don't just have an Epic analyst going in and changing a setting in the CDF or updating a rule. You've got multiple teams and a lot of people involved. That's, I think, where we see a little bit more of the delay, or the, you know, the amount of time and effort taken is going to be greater in those cases. But it's also helped reprioritize those items, because they know that authorizations are an issue, or they know attachment denials are an issue. But by us being able to quantify that and be able to say, you know, if this functionality is implemented, this is the expected change, the man hours that you will save, because we can track, you know, okay, well, what's getting appealed. And so even if we're just using assumptions on how many of these could be worked an hour, you get a sense of, you know, how much time savings for their follow-up team. We get a sense of how much more in appeals you'd be able to work through. And so that's helped drive those conversations to make change a lot faster, where it may have been on the back burner previously.
I'm thinking about just like a recent client I worked with, and they had a all their denials are outsourced. And I'm thinking about the conflict of interest of, like, if you outsource your denials, they're not interested in preventing, they're just going to work because they want their volume. And like, if you prevent, then their volume goes down. Do you, when you're getting plugged into an organization and they're thinking about prevention of denials, like, where does that stand on their priority list? As far, like, are they more interested in preventing, or are they like really just focused on, like, give me data so I can like work these and get these, like, these fixed? I'm curious where you sense prevention, like future denials, on priority lists for organizations that you're working with.
I think that's always the ideal. If you can prevent it and you can figure out how to prevent that, that's always going to be preferred over any amount of having to appeal. Not only in the sense that your team doesn't have to work them if they come back denied, you get your revenue faster and it reduces noise, improves your metrics, everything like that. So I think it depends on really what can be prevented. Because something that we see all the time are these attachment denials from your typical commercial payers, and they're just on regular office visits. And you're not going to send medical records on every single 99214 that you bill out, because that's just outrageous. And if only 3% of them are coming back with an attachment denial, that doesn't make sense to necessarily prevent that. But if you can automate the resolution of that front to back and then see payment without any manual intervention, it's not as good as preventing it ahead of time, but that's about as good as you can do whenever you don't know exactly when or why that denial is going to come back in. So if it's a discrete fix, that's ideal. If we know that it can be prevented, great. But there's still so much value in these other cases in terms of focusing about on when that comes back, what are we doing, how can we do it better?
Yeah, and I think there's also the component about stopping issues before they become, you know, large items that you do see on like your slicer dicer, for example, or that you do see huge denial issues on your dashboard. You know, when we're working with these organizations and we take years of historic data and we're training our models specific to them and their, you know, facilities, we're also able to detect trends just much faster. You know, so not only are we going to show you everything that happened previously, but now if suddenly this payer for, you know, X procedure, whatever scenario you want, like if they were previously only denying this 10% of the times and suddenly over the last month we got a significant spike in that, that's allowing us to identify things far faster than until it becomes until it starts clogging your work queues. Also leads into those conversations with operations like we talked about earlier. You know, those are more discussion points to say what either changed in our build, what different payer policies came out. Like, let's make this a discussion to see how we want to prioritize this moving forward. And let's, you know, keep playing the game of whack-a-mole, like Austin said. Let's stop this before it happens. And then when the next one comes up, we'll do the same thing.
So that makes me think, like, with Epic's push for payer platforms and leveraging more and more trying to get more and more payers and health systems to adopt that licensure and do data exchange through payer platforms and eventually even claims exchange, right? Have you had any clients that are doing payer platforms today, or are you and how are you guys seeing an uptick or a downtick in denials? I mean, I'm guessing we're going to see a larger uptick with denials eventually, but kind of trying to understand that.
We've had a couple clients that were in the process of implementing or exploring it. I think payer platform sounds great, but I would need to see more of it before I'm sold. I think it's still very early on. I think it's going to streamline a lot of items like the authorization requests, attachment requests, where the payer is willing to pay. They just need some additional information. And so I think those cases are going to be great. But I guarantee there's still going to be other reasons that are not going to be able to be resolved through payer platform, or payers are going to look to try to deny, not just because they truly are willing to pay and they just need some extra information, but because they're just trying to kind of create some noise and mess to save money. So I think there's a lot of potential with payer platform, but it's still really early on. And I'd be surprised if there is total adoption of that across all insurance companies. And, I don't think it's going to drive the denial rates down to zero.
Yeah, I get worried with payer platforms of just what are they actually accessing beyond what the intent of it is, right? So
Yeah, I think it's kind of funny. We talked about earlier about wariness in the industry of different tech solutions, and then we feel the same way sometimes. Us as tech vendors, we see other organizations come out and say, here's what we're going to do, and we're like, wow, that sounds like a lot. Is that actually gonna happen? So it's just kind of funny to be on the flip side of that too sometimes.
all right. Well, before we go to another break, in wrapping up this segment, what's one thing that you guys could recommend to potential clients or even just listeners out there that they should start to dive in and think about as they're looking at for denial prevention?
This is another good question. I think if there's one thing, it's probably to really try to quantify your issues beyond just what you're seeing in dashboards or a denial report that shows you, total volume by CARC or dollar amounts. I think it's really digging into what would the impact of this optimization be, in the sense that, you're going to have a dozen different optimizations on the back burner, and you can really only take on, a few at a time. And so the prioritization of that by digging into the data that you do have available, I think that's probably the biggest piece. You're never going to address everything, but you need to make sure the priorities are correct.
Yep. Yeah, I feel the same way. I think along the lines of efficiency as well, Austin. That's always where my mind goes anywhere that I'm working, is like, what effort people are always stretched on man hours. So with those man hours we are using, what's the actual output of it? Like, are people in work queues because they need to get 10 done a day, but then like, what 10 are we actually getting done? What are the small wins for work queue organization or scoring that we can input to make sure that our hard hours we're putting in are producing good output for us? Yeah.
All right. Well, let's take a break and we'll be right back.
Are you ready to unlock the full potential of your medical coding team? Look no further than Adeo Technologies, the leading provider of medical coding productivity solutions. With Adeo's Gemini Solution Suite, medical coders are empowered and complemented with cutting-edge tools and technologies. The Gemini Coder platform, Gemini Autocode, and Gemini Coding Assist solutions work seamlessly together, creating efficiency and improving accuracy in medical coding. Say goodbye to tedious manual processes, cheat sheets, and memorization, and embrace the power of workflow improvements, artificial intelligence, and predictive coding. At Adeo, we believe in the collaboration between medical coders and artificial intelligence to create coding capacity that makes human coders more valuable to their healthcare organizations. Visit our website at www.adeo-technologies.com adeo-tech.com. It's adeo-tech.com to learn why we love coders and how Adeo Technologies is transforming medical coding productivity one claim at a time.
Claim Capital is a team of ex-Epic staff focused on preventing denials. Instead of showing what was denied, which is the standard for other solutions available today, Claim Capital pinpoints why claims are denied. By training machine learning models on an organization's claim and remittance data, Claim Capital can identify the causes of denials and recommend changes in EHR build or workflows to prevent them from happening in the future. With a completely HIPAA-compliant infrastructure, no software implementations, and a zero-risk pricing structure, organizations can quickly and safely recover lost revenue.
And we're back.
All right. So we're going to wrap up today with the Wilshire Lab, and we're coming back from the holiday break, and we want to have our listeners get a little bit of insight on what it means to be in healthcare IT. And maybe just start us out, Spencer, we'll give you the first question on what drove you to work in the healthcare IT space. Was this on your radar or something you were interested in, or like, I know everybody at Epic has like it seemingly like a crazy story of how they got here. Curious what yours is.
Yeah, I think it is a crazy story. So, I mean, I grew up in Virginia. I was supposed to work for Geico in the claims department for their office in Fredericksburg. And I got an email from Epic, and I responded and I said, is this a spam email or are you a real company? And the lady assured me that it was a real email. So when I got there and I went through the interview process, ended up loving it. And they put me on the claims team, which I don't know if that was because I was in the claims automotive stuff for Geico, but I was like, maybe they thought it was the same thing. I don't know. But yeah, it was never an area that I grew up thinking I was going to move to Wisconsin and just make this my area of expertise. But, you know, you work at Epic for a few years, you get a lot of really niche specific knowledge, and you pick up the tech that, like Austin described, to be able to see areas that can be improved. You know, I think it's always a good sign of, you know, your mastery or your comfortability in an area is being able to see where you can improve things. So yeah, never pictured it growing up, but I'm happy to be here now, and I'm looking forward to both the work we're going to continue to do, and just seeing if we can make any, like, you know, as a lofty goal I always think of, can we make like lasting impact in the area of, you know, the healthcare billing field, you know?
What about you, Austin?
Oh.
Yeah, very similar. I had no intention of going into healthcare prior to that Epic email. I was studying to be an actuary, and I always loved data analytics, math, and I figured if they're going to pay me to take math tests, then being an actuary sounds great. But as I was completing my degree, I realized that I didn't really want to, you know, be locked away calculating insurance premiums all day. I wanted to do something with a little bit more engagement and exposure. And then I got the Epic email. It sounded like a very interesting opportunity where you get exposed to a lot of different elements. You have the project management, but you also have the technical. You get to dig into software. And that was really where my interest was being directed toward. And then getting to Epic and seeing how crazy of an industry healthcare is. All these issues plaguing it, the competition, the fight between payers and organizations, and all the nuance of it. I fell in love with the industry, and so I'm happy to still be here, and I'm glad that I found it.
Well, taking a little bit of a different spin on the question, we have been asking all of our participants on the podcast, our guests, to give one piece of advice to somebody who may be starting their career or restarting their career and kind of made a career leap. What's one thing that you guys would recommend to somebody jumping into the healthcare IT space?
I think don't be afraid to take a risk, especially if you're early in your career, because you have so much potential. It's just going to become increasingly more difficult to take that leap and make a risky decision the later you are on in life. If you have a family, if you have kids, if you have a mortgage, at that point, your risk tolerance is likely a lot lower. And so the thing that kind of let me take the leap to step away from Epic and, you know, start a company and get rid of a, you know, decent paycheck is I just kind of look at the worst case scenario. And if you get really comfortable with that, as that being an actual potential, then it lets you take the risk and really be able to sit down and focus to work on the bright side, to work toward that optimistic outlook of, well, what can I do? And the fact that you don't have to ask what if anymore because you took the leap, I think that was the biggest driver for me. So I think being willing to take a risk is my biggest piece of advice. Do it while you can.
Yeah, and I think a lot of times it's easy to get stuck with a like a decision paralysis, whether it is going into healthcare IT specifically or any other field. It's like there's so much information available at our fingertips all the time, and it's really easy to say, I need to research everything A to Z to 100% before I even start doing this. And that's a great idea, but a lot of times that just stops you from ever taking that first step because you feel like you're not ready, as opposed to get your baseline, make your foundation, start doing something, and then let the problems come up. And that's how you learn along the way when you actually understand what you're doing in the first place. So yeah, I agree with Austin. You just got to start doing it and let yourself learn along the way.
Cool. Well, thanks for joining today. Appreciate the insight on startups and data and talking about denials. I know my day is spent just going through denial data, so maybe I should try to push for a little bit better solution that I can work with, but maybe a conversation for another day. But for folks who want to reach out to you and want to connect, whether it be just for a question or maybe some sort of engagement, what's the best way to connect with you?
Yeah, we have our Claim Capital LinkedIn page, of course. I'd still check that every day. We have our Claim-Capital website as well. If you just Google Claim Capital, it'll be the first thing that shows up for you. I'm always happy getting an individual email as well. So, you guys are welcome to include my personal in any kind of podcast notes or anything, and would be happy to hear from anybody.
Awesome. Well, I think that's it for us today. This is season 3, episode 1, name to be determined. But thanks everybody for listening. That's it. Bye-bye.
If you liked today's episode, continue to join Wilshire Wednesdays.
You can follow us on LinkedIn or Twitter at Evan_Wilshire. Daniel can be followed at Daniel_TWG. Wilshire Group at TWG Health. On Facebook at the Wilshire Group or on Instagram at Wilshire IT Revcast.
Remember, if you prefer to watch, come check us out at the Wilshire IT Revcast YouTube channel.
If you have an inquiry, want to share your thoughts, or get additional information on today's episode, email us at WilshirePodcast@thewilshiregroup.net.
The best way to support this podcast is to review, rate, and subscribe. See you next time.
Bye-bye.
The Wilshire IT Revcast is hosted, produced, and engineered by Evan, Martin, and Daniel Bianchini. It is executive produced by Gretchen Case, Hank Smither, and Spencer Thielman. The Wilshire Group. Experience you can trust, results you can count on.